I have taken this ECG from ecg.bidmc.harvard.edu, and I want to give credit to this website. You can see also copyright is to ECG Web Maven, Beth Israel Deacon's Medical Center. So I am using this ECG just for educational purpose. So there should not be copyright issue that I am displaying this ECG to you. We can use image for educational purpose. So now let's come to this ECG. So till now you might have guessed what is the abnormality in this ECG. If you are familiar with ECG diagnosis. So what abnormality do you see here? If you want to know my opinion, what I can tell you that if you see the rhythm strip lead to, these rhythms are irregular. So what I can see when I look grossly, right? And this P wave, see this P wave is different. This P wave is different. So you can see this P wave is different. So morphology of P wave are different. So definitely this P wave may be originating from SA node, but this is originating from ectopic focus. Right? This may be originating from SA node, but this may be originating from ectopic focus. So definitely there are two focus of atrial depolarization. And what is the rate here? This is the 10-second rhythm strip, and in this 10 second, how many QRS are there? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So in 10 second, there are 12 QRS complex. So in 60 second, if you multiply 12 into 6 is equal to 72. So the rate will be 72 per minute. So ventricle is depolarizing at the rate of 72 per minute, right? And you can see here PR is also prolonged. If you see this PR interval, it looks prolonged. It is more than 200 millisecond. If you calculate it, it is more than 200 millisecond. So these are the abnormality that I can see in this ECG. Other than that, ST segment is not elevated, depressed. T wave, I don't think there is any inversion, any abnormality in the T wave, right? QRS width is within 3 small box, suggestive that of conduction is going through the normal conduction system. So what is the diagnosis? This is premature atrial contraction and first degree heart block, right? So this is premature atrial contraction. You can see this morphology and this morphology is different, and this P wave is occurring orally. So you can see the interval between QRS, or if you want to see the interval between P to P, this P wave is occurring orally compared to earlier P wave. So that's why we call it premature atrial contraction. Similarly, here you can see this is occurring normally from the sinus node, but here ectopic focus is firing, and that ectopic focus impulse is again traveling through the normal conduction system, and it is creating a QRS complex, right? So QRS morphology is almost similar everywhere, because this even ectopic impulse is traveling through the normal conduction system, and that's why QRS morphology is same.